morning. So as you make your way through the world of dialysis, I'd like to introduce you to the access table. I want to help you understand when your loved one is on dialysis, what does that mean? We're going to talk about the different accesses that are available to your loved one so that you understand how they receive dialysis. When they're on dialysis, they are here because their kidneys are no longer functioning at 100%. We need to remove those toxins and fluid that the kidneys normally would do. There are 3 types of accesses that we can use to remove the toxins and fluid from the bloodstream, one of the ways that a patient can be on dialysis. Our first option is a fistula. This access is formed by taking the patient's own artery and own vein and connecting the 2 of them. This type of access is the primary and first choice of our providers and our clinical staff. Though it takes the longest to heal and be ready to use, it is the best option out there. This type of access, the fistula, has the lowest rate of infection and other complications. Our second type of access is the graft, and in front of me I am holding a graft segment. Through an outpatient procedure, this segment would be surgically connecting a patient's artery and vein. As you can see, it is very pliable. This is the second preferred method for a dialysis treatment. Its lifespan is not as long as a fistula, but it still has many pros to keep it at the top of the list. Our third option for a dialysis access that uses the bloodstream is our central venous catheter. When your loved one has a central venous catheter, it looks like this. You're going to see this segment outside of their body. It travels and is implanted in the vessel, and the tip ends up going right here in the upper chamber of the heart. This is the least preferred access because it's a foreign object. It is high risk for infection and has many complications. As you can see, a catheter is quite intensive. All 3 of those types of accesses can be used in-center, at a clinic, or a patient can do dialysis at home using those accesses. If your loved one chooses to not use their blood system to remove toxins and fluid, but wants to dialyze at home, we have an additional option for those patients. We have what is called a peritoneal catheter. This catheter is implanted in the body where we have this segment that is exposed. Inside the body is the remaining piece of the catheter. It hangs down inside the abdominal cavity. Using a peritoneal catheter does not involve the bloodstream and does not involve needles. So for some patients, this may be the ideal choice. We have a great brochure within Fresenius to talk about all of the dialysis option types. Please feel free to ask questions, and thank you for visiting the Access table.